Ablation of ventricular arrhythmias. Definition: one such technique is stereotactic of body radiation therapy, which delivers present high-dose radiation to targets instead body with minimum damage to normal. And as you say, this therapy has resulted in latent myocardial fibrosis and electrolytes inert dies without evidence of cure.
Depending on activity level, the heart beats about 60 to 100 times per minute. It may be higher during exercise or lower at rest. A normal heart rate and rhythm ensures the delivery of oxygen-rich blood to all of the body's organs, such as the brain and lungs. A group of cells in the heart, called the cardiac conduction system, uses electrical impulses to control the speed and rhythm of each heartbeat. An abnormal heart rate or rhythm, called an arrhythmia, occurs when there's a problem with the heart's conduction system. Tachycardia is a type of arrhythmia where the heart beats too fast. Fibrillation is a type of arrhythmia where the heart beats irregularly and may be too fast. For certain electrical impulses and prevent an arrhythmia from happening. If the cause of the arrhythmia is in the ventricle, the doctor can do either focal ablation or ablation remodeling to treat more complex arrhythmias of the ventricle.
Application in medicine. Non-invasive ablation of carotid is to control the ventricular tachycardia is novel therapy considered in the management of ventricular arrhythmias associated with structural heart disease. The technique involves the use of static radiotherapy delivered to VT substrates.
Hi, I'm Dr. Richard Hongo, and I'm a cardiac electrophysiologist. Today we're here at California Pacific Medical Center, which is in San Francisco. This is one of our dedicated electrophysiology labs where we're very fortunate to have cutting-edge technology that allows us to perform complex catheter ablation procedures, such as ventricular tachycardia ablation. Ventricular tachycardia ablation is all about finding the spot or the short circuit that is causing the rhythm disturbance. And using catheter-based technology, we find and eliminate the cause. Here at California Pacific Medical Center, we have our anesthesiologists sedate our patients very comfortably at the onset of the procedure. And through a small incision that I make at the groin site, I place sheaths into the vein between 50 to 60 degrees Celsius. Now, this in and of itself is not very hot, but when kept on one spot long enough, somewhere between 30 to 60 seconds at a time, that's enough to cause some denaturing right below the tip of the catheter itself. And this denatured tissue stops all electrical conduction. And over a few months' time, this denatured tissue then heals itself into some permanent scar. And this is what keeps ventricular tachycardia from reoccurring. So in summary, catheter ablation for the treatment of ventricular tachycardia, you're dealing with ventricular tachycardia.
Using in Ecuador, novice the ablation of cardiac arrhythmia using starting strengthened relatin deficits have been reported. offering present targeting of myocardial uplink system now embellishing with 4D inches of anatomic cortex using Catheter specific planning of training software, with minimal value exposed outside of the training target. The process is painless and does not require nested and buried of radic sorting platform can be used. Pros and cons. Evaluating path can be used to identify targeting the use of not embedding ACG and imaging, changing combining with a multiple interleaving body surface. ACG recording after the exposure of and completing now embedding approach. Early casting studies have demonstrated unconstant degradation in BT borderline substances early softened to welding more than the latent multi-center studies.
Now, here's your 2-minute take on area businesses, communities, events, and entertainment.
Hi, I'm Dawn King. Here's Jim Hall with Catholic Regional Medical Center.
Thank you, Don. Today on 2-Minute Take, a new medical specialty is available full-time in the Tri-Cities. It's called electrophysiology cardiology. And joining us this morning is EP specialist Dr. James Kneller. Dr. Kneller, who qualifies for what you call an ablation procedure for folks suffering from atrial fibrillation?
Right. So we offer ablation procedures for atrial fibrillation to patients who are sufficiently symptomatic, meaning this condition is really actively bothering them in their daily lives. And we usually ask them to have tried at least one antiarrhythmic medication to control the AFib prior to offering the ablation procedure.
And what is an ablation, actually?
So an ablation is quite a sophisticated procedure. Takes us 4 to 6 hours to complete in a cath lab. We're going into your heart with catheters, entering through the veins in your groin. We thread the catheters up into your heart. The catheters are thin tubes like spaghetti, follow the blood supply very naturally into your heart. And we position those in
Kneller, you can give his office a call at area code 509-942-3272. Our thanks to Dr. Kneller, and thank you for watching 2-Minute Take.
Conclusion. Testing is limiting no invasive story time. Reality has usually displayed extent the therapy or for ventricular arrhythmias and clearing words for the investigation. Only his safety and efficacy can be explained in larger trials. Here should be counting openness.
I've always been interested in the heart, even since high school. And for some reason, I got drawn into transplantation. I want to be able to give back a lot to the patients that I take care of. And heart transplantation is kind of one of those things that is the ultimate, where you really give back to someone, their life, their family, and themselves. It's not so much that a patient comes in, gets surgery, and is forgotten. From the moment that the patient, I see the patient, and the patient becomes part of the entire team that we have here at the Cleveland Clinic, they become like family. We know everything about the patients. We try to understand what their issues are and what their problems are, and it becomes a journey because heart failure is a chronic condition. There's been patients where I've transplanted perhaps their mother or father, and then their younger child is afflicted with the same problem. And again, because of the way that we really develop a relationship with the patients, they always come back to us because we have that really deep relationship with them. These are very complex questions in terms of when is a patient ready to be transplanted. There are times that the patients are very anxious and they want to get transplanted, and I can understand, the emotions that they may be going through. We've had enough experience to know that when we need to wait a little bit longer to perhaps get that perfect heart for them, even though they're anxious in terms of the fact that they want to move forward. How have I changed as a physician? I think I've become wiser, and there's no question that experience counts a lot in this field. I'm very different from when I finished my training. I've remained passionate as I did when I finished my training, but now I have the 15 years of experience behind me that's very difficult to learn in any textbook or learn from anyone. It's something that you need to personally experience, and that's probably one of the biggest assets I have. I always tell my fellows and residents that we can teach anybody to sew, but it's the judgment which comes with experience that differentiates an excellent outcome from one that is less good.